Okay, ladies and gentlemen, you're about to receive the world's first international medical podcast, hosted by three paramedics from different countries. Live from the UK, Finland and Australia, this is Group Call.
Hi guys, and thank you for tuning in. I will be honest with you, we had completely different idea for this episode. Actually, we wanted to check where is the line in the sand for medics on social media. You know, all those pictures with alcohol in bikini and stuff like that. But then I saw this tweet. And this is a tweet by Stephen King, who says that as of 25th of September, babies will no longer be delivered at Lewis County Hospital in New York. 6 maternity ward workers are resigning rather than get vaccinated. That's where we decided to check what is the agenda, what is the approach amongst medics towards the COVID vaccination. We've got Harrison, we've got Timu, so let's get started. Let's roll the intro. As everything started in America, let's see what Gina Luriwendi would like to tell us about situation over the pond.
Hello. Hi. This is Gina Luriwendi. I'm coming to you guys from St. Louis, Missouri. I'm currently at Abbott AMR, St. Louis location, and one of their Abbott SET ambulances. Today's topic, we're talking about vaccination, COVID vaccinations, and employees, what they thought about it, and things like pertaining to COVID vaccines. So with the current moment, in the state of Missouri, everything changes currently to the day-to-day, as well as the United States. So when you guys see this, it's probably going to change. Doses fully given in the United States is 381 million. Fully vaccinated is 179 million. Percentage of our population of the United States is 54.6%. Where I currently live in the state of Missouri, we're at 6.11 million doses given and 2.85 fully vaccinated. That's pretty cool. 46.5% of our population. That's awesome, guys. So at the current moment, nothing is mandated by our President Biden for the current moment regarding employees that are government employees, that are military and or first responders, physicians, nurses, fire departments, police officers. Nothing's mandated at the current moment. Again, things can change. For the most part, we have the 3 shots that are able and available for us to administer and or be administered. So we have the Pfizer, we have the Moderna, and we have the Johnson & Johnson. With the 12-year-old age group and older, we're allowed to administer that Pfizer. Here in Missouri, we have less than 18 years of age, 12.3% is vaccinated. That's awesome. 59.2% is from ages from 18 to 64. So that's awesome. That's that group that could have exposure because we're out and about, we work, we have children, things like that. And then 90.1% is our 65 years old and population and older here in the state of Missouri. So with that being said, we're talking about statistics of new cases in the United States. It's 808K, or deaths are 11,766. So with that being said, there are significant more positive cases and as well as deaths here in the United States as well. So COVID is very real. So with that being said, I I'm fully vaccinated. As soon as I was able to get the vaccine, I got the vaccine. But I've spoken to many of my coworkers and many of my students because I teach as well, and they all said there was not enough information, and they're correct. If you go to our local grocery store and you say, hey, I want to get the COVID vaccine, they're going to say, oh, great, here you go, stand in line, sign this paper saying that you're going to attest to getting this shot here, and we're going to monitor you for 15 minutes, and if you have any signs and symptoms, we'll call the ambulance. Okay, great, but there's no pamphlets around that I can find just laying around. But there is signs. They're saying that it says COVID, please wear a mask. If you're symptomatic, don't come in. And that's pretty much where it's been. But on the internet, there's tons of resources. So there's, and the actual CDC, they have tons of papers you can look up. There's tons of knowledge. And then education. So here at in one of my jobs, it is required to have the vaccine. And that came into effect in September, and they were going to say, hey, at September 16th, if you guys don't have both vaccines, then you're going to be put on administrative leave. Well, a lot of my students were like, whoa, holy cow, does this affect us too? And I was just like, well, wait a second, let's figure it out. So with that being said, they kind of felt violated. They kind of felt like they didn't have any other option, that they were going to have this. And yet they're screaming, well, I want education regarding these shots that you're going to put into my body. So that's where a lot of the on the fence is going, because it's not really, talked about. Some of the products are like Pfizer, and then of course our Johnson & Johnson, because somebody had a rare blood disorder and an immune response to that shot. So then they took it off the market, and then they re-amped it and put it back onto the market, but people still are afraid to get that shot because of it. I can tell you one thing, that I've transported people that have had the shot, and they're less sick than those that have not had the shot and then get this new variant of COVID. They've been intubated, they're super duper sick. They have this purple magic medication that helps within this COVID that's infused through this ET tube. So with that being said, COVID is very, very real. I remember when COVID first started and we didn't know anything about it, and I'm in full PPE precautions and just crying because I cannot help this person in respiratory distress. So therefore, of course, and as soon as it was able to, me and a couple other people, we felt the same way, as we don't want to be these people that are laying unconscious, unresponsive on my stretcher. So with that being said, it is your body. You do have a free will. And I hope you have a great, healthy, and blessed day. You guys are amazing. Have a good night.
Thank you, Gina. The fears and concerns Gina mentioned, there was a quite interesting poll conducted by Medscape UK in November 2020. But before I will tell you about those concerns, let me quickly give you a British view and a Polish view in a second. So in February 2021, the government here announced that COVID vaccinations will become compulsory for staff in care homes. There is a huge discussion at the moment over should the same measures be taken and the same precautions taken in with the NHS, so frontline staff, ambulance staff, A&E staff. However, we don't know what will happen. So legally in this country, there is no exemption to the law that will allow an employer to force the employees to receive a job. A flu job, COVID job. However, there can be an approach, no job, no job. Will it happen? Let's see what Professor Whitty, the chief medical officer, said in terms of no job, no job.
My view is clearly for medical staff, where I am subject to the same code. It is a professional responsibility for doctors to do things which help protect their patients, and I expect that to be a professional responsibility for all other health and social care staff as well. Now, questions around contracting are not really for me. The only comment I'd make on that is there has been, it has been a norm. For example, there's an expectation if you're a surgeon, you've got a hepatitis B vaccine. So it's not that this was completely new territory, but I think that's not really a question for me. That's a political question. The professional expectation, very strongly, my view is professional medical and social care staff should be taking.
That was Professor Whitty, the chief medical officer. Now, a recent study, and that's the latest data I could dig out for you guys from September, showed that 91 of frontline healthcare staff are vaccinated, with 95% of doctors. I could not dig anything for nurses and paramedics. I'm sorry if you guys, our amazing viewers, our amazing listeners, if you have any data about paramedics and nurses that are reliable, please pop it in the comment section below, or come up in the chat. Try to help us with this topic. Now, I said 91% of frontline staff, but those numbers are getting significantly down in London, with 76% of frontline staff vaccinated, and that's the country's worst refusal rate. 76% frontline staff vaccinated. Now, I promise that I will tell you about fears and concerns in this country. So, Medscape UK conducted a really interesting study, poll in November 2020, and we have 56% of those who are refusing to get a job raised as safety concerns without any specific safety concerns. It's just safety concerns. 27% of people who don't want to be vaccinated, and I still mean the healthcare professionals, they say, I would rather wait. 7% raise personal health issues, and 14% other reasons. So we don't really know. So that's the current situation in the UK. If you ask me, I'm fully vaccinated. I'm ready to show you my COVID-19 vaccination pass if you want me to. But that's my personal view. I also promised you a Polish view, so let's jump to Poland. Marcin Soboń.
Hi guys, my name is Martin. I work as a paramedic instructor for Falk Poland, and a few days ago Alex showed me the tweet by Stephen King and asked me to describe the situation here in Poland. At the moment, the COVID vaccination in healthcare setting is not mandatory, and according to the government data, 94% of physicians and 90% of nurses and paramedics got their COVID jab. There are some medics who contest the credibility of the vaccine and even the presence of the pandemic itself, but I would say they are in minority. I know only personally one paramedic who refused to have his COVID jab, but he's not really open about it and definitely doesn't share his personal view on the social media. In summary, I wouldn't say that not having the COVID jab is a thing in the healthcare setting. Vast majority of medics have it or will have it soon, and overall vibe towards the job is very positive. That's all folks, stay safe guys, and see you.
So yeah, I was actually wondering, as a kind of a segue to the Finnish side of things, can the employer in the UK actually ask you to provide evidence of the COVID vaccinations, Alex? Okay, yeah. Because the data that I got from Finland, I was looking up on it online. There's no data for healthcare workers actually, and I will come back to it. At the moment, as like the society as whole, one jab is 73.4%, two jabs 59.1%, and they are talking about opening up the country when it's two doses, or like people have gotten it like 80%. So yeah, in terms of medics, nurses, paramedics, doctors, the issue that we are having at the moment is that basically nobody, not the government, not the employers, they are not allowed to actually ask anyone their health information. So I don't have to provide my health info to my employer. There's no law, there's no requirement for me to do that. It's been a thing with like flu jabs in the past that you are required to take it if you're working with like vulnerable people, children, the elderly. But then again, nobody is asking that information from you, so nobody can be sure if everybody's vaccinated. The studies that have been done on the amount of vaccinations taken with the flu jabs, not COVID jab, usually have shown that doctors are really compliant, close to 90 or above 90%. Nurses and paramedics are included in that as well. Unfortunately, not as much. So the worst data that I found was that in a certain regional hospital, only 20% of the nursing staff got the flu jab. Obviously, those are from like all the wards, so not all of them treat children and the elderly. But then again, in the hospital, a lot of the people that are there, a lot of the patients are quite vulnerable because of their situation, at least at that time. They are now talking about introducing mandatory COVID vaccinations out, and they are talking about ways to figure out who has been vaccinated and who hasn't been vaccinated. And then if you refuse to get the shots, it will probably be the same situation as they've been talking in the UK. No jab, no job. Because with the flu shots, it's been the case that if I refused, I would then voluntarily wear a mask during the flu season. But now it doesn't really make sense because everybody's wearing a mask anyway. So that doesn't really provide any more protection if you're not vaccinated. I talked with my peers at work, and nobody admitted to like not getting the vaccination. So as far as I know, everybody is vaccinated, and even though I said like really bad statistics with the flu jabs and all that, I do believe, and I am quite optimistic, that people, especially frontline workers like A&E staff and paramedics, have been pretty compliant with the vaccinations. So I think that's the best we've got. Optimism.
Thank you. Mr. Steed.
Yeah, thanks, Alex. So it's interesting what you were saying, Timo, in terms of the employer not being allowed to ask the employee for their medical records, essentially. But what I'll ask you both, so I'll start with you, Timo, is when you were employed, when you were going through your application process, did you need to prove a level of vaccination for any other diseases, such as hepatitis or anything like that? Was that like a requirement of your employment before you were employed?
Yeah, there was a questionnaire that I had to fill out. But then again, like there was no actual proof of the vaccinations given. So it was basically like my word, and then the employer would take it. And it was actually a thing as early as the beginning of my paramedic studies, because we obviously do placements in places that are treating the elderly and the children and a lot of vulnerable people. So we had to have vaccinations when we started school. But yeah, it was just a matter of I say I am vaccinated, therefore I am.
Yeah, interesting. And how is it over in the NHS with you, Alex? Was it a requirement for your position?
Yeah, so at the moment, as I said, it's not compulsory. It's very individual thing. So yeah, the employer can ask us to provide a proof of vaccination. However, is it a thing at the moment? I don't think so.
Yeah, so that's interesting. So I only have the data for my employer and where I work, but I believe my impression is that it's the same across Australia. But prior to your or during your application, you have to show your employer that you have either been vaccinated or have immunity to hepatitis B, chickenpox, measles, mumps, rubella, and whooping cough. They were the mandatory ones. So you had to provide either a vaccination record or a serology report saying that I have immunity to these viruses. And as you said, Timu, how you have your university placements, you actually have to do that as well. Prior to your placements as well, you have to show that. So those are the mandatory ones, and there's a couple others that are strongly recommended. But prior to actually entering the industry, you have to show mandatory immunisation for these, which is why it's somewhat interesting. I find that there's, even in Australia, there has been a bit of a kick up against this mandatory vaccination for COVID, because as paramedics, and I believe as other health practitioners, have a very similar framework. That we already have mandatory vaccinations in a sense. It's not a law so much that to be a paramedic you have to be this. The way they word it is it's a requirement of your role to be vaccinated against these certain diseases, and that's how they kind of word it and sort of get around it. So in terms of our statistics, so it sounds very similar to what Finland have in terms of our vaccination in our general population. So we've got about 74.1% of the eligible population that have had one dose, and 49.3% that are fully vaccinated. So that's in Australia, and the stats for Victoria, the state where I live, is very similar. Only varying by a couple of percent there, so really not too much. So 45.9% fully vaccinated in Victoria, and 75.4% have had one dose. In terms of the statistics for health practitioners, and like Tim, I've only got statistics for paramedics, but from what I have been made aware, that it's very equitable across nurses and doctors as well. But for paramedics in Victoria, 91.2% of workers for the company, for the organisation, have had one dose. So 91.2% one dose, and 75.6% are fully vaccinated. Now, in terms of how many employees in the state-based ambulance service, there's about 6.7 thousand. So there's roughly 5,700 clinical staff, and there's another 1,000 admin staff. And traditionally, obviously, your clinical staff, your medical personnel, are more likely to be vaccinated, and likewise, they were in the highest priority to get the vaccinations when they were actually rolling out. Because in Australia, we've had a bit of a slow rollout with our vaccinations. We're quite behind a lot of other countries. And there's a couple of reasons for that. So in Australia, the only one that we can make domestically is the AstraZeneca vaccine, so the Oxford University vaccine. And it has been shown to be slightly less effective than the mRNA vaccines that are becoming a bit more popular. But also there's been a lot of media around the thrombocytopenia reactions as well, and people say, "Oh, it's too risky, and a lot of people are seeing it as being unsafe. And I'm sure we'll talk a little bit more about how things are perceived in the media as well. But because we're a little island stuck in the middle of the ocean, unlike some of you more continental people, it's the actual access to the vaccine has been a bit poor. So we have been a bit delayed there. Yeah, generally speaking, in healthcare, healthcare industries, the uptake has been good. And it was early, starting in about March or so was the initial rollout. So we are ahead of the general population here. But in terms of the view of mandatory vaccinations, from the majority of people that I work with, I can't recall one saying that they disagree with mandatory vaccinations amongst paramedics and amongst medical services. And perhaps that's due to the reasoning that I mentioned before, that we already, in a sense, have mandatory vaccinations for certain illnesses. And there is talk of it being added to that list of requirements for your role. So in Australia, or in Victoria rather, in my state, healthcare workers have until October 15th to show that they've had one dose, or they are at least booked in to receive their first dose. And if they're unable to do so by the 15th of October, then they're unable to work in the industry. Now, at the moment, it's not clear whether that's just patient-facing roles, whether someone might be moved to an admin role, for example. But at the moment, that's the case here. Now, and I'm sure, again, we'll talk a bit more about advocacy and our role as healthcare professionals. In England and in Finland, are you guys considered a registered profession?
So in Finland, I'm registered as a nurse. I do have like special training, obviously, to be a paramedic. And then if I want to get a role as a paramedic, especially like at the advanced level that I work at, I need to provide evidence of that training to my employer. But the profession and the job title, or that the role title as paramedic, is not actually registered.
So in the UK, the title is protected, and we are registered healthcare professionals.
Yeah, interesting. So in Australia, since December 2018, paramedics has been a registered profession. So prior to that, what made you a paramedic is essentially your employer saying that you are a paramedic, and you can kind of do what you want with that. But since then, it's been a registered profession, and with that has come a bit more oversight in terms of the role and the responsibilities. So we're governed by an organisation called APRA, which is the Australian Health Practitioner Regulation Agency, and so they have a lot of codes of conduct and requirements for, say, educational and professional conduct. But I've actually got an excerpt here of our code of conduct. I'll read out for section 5.4, and this part actually talks about public health. So it says practitioners have a responsibility to promote the health of the community through disease prevention and control, education, and where relevant, screening. So essentially what that's putting into this code of conduct is that we have a responsibility to advocate for public health, and we play a role in this, not so much actually providing this care, but advocating and educating the general public and our patients on that. And indeed, there actually has been, I'm specifically aware of at least one person that has lost their professional registration and therefore lost their employment because they have gone against this. They were very overt with anti-vax beliefs, their own beliefs, and were recommending people breach public health orders and that sort of thing. And like on the internet, nothing's secret. It's always there. They were reported to APRA and they lost their registration, and from that lost their employment. So I'm sure we'll talk a little bit about our role as paramedics and what our responsibilities are with helping to further this cause of vaccination.
Timu?
Yeah, that's an interesting point that I was actually thinking about while listening to Harrison talk about it. because like I think the consensus here in terms of mandatory vaccinations, let's say for paramedics, because that's what we know best, I think the consensus is pretty negative towards it. And I have to say, I am very negative towards it. I don't like the idea at all. But that being said, I do think every paramedic should get vaccinated. But I think the issue of like getting to that point is a educational issue, not a like a rules and laws type of issue. So that you can't force people into it, and you could, but it would be a much better route to take to actually educate people to make especially healthcare workers, healthcare providers, kind of resilient towards all of this anti-vax mentality and, dare I say, propaganda even. So I think it's an educational issue rather than just making laws to force people into it. And it's clearly showing a big problem within the education system that we have this situation where trained, highly educated healthcare workers are refusing a proven prevention, like a vaccination, proven prevention mechanisms for communicable diseases. Yeah.
So what about the Professor Whitty's words when he said about surgeons and mandatory vaccinations for example, Hep B. Should COVID vaccination be mandatory as this one? Because it is a case, right? You can actually say if surgeons have to be vaccinated, why not other healthcare professionals? Mr. Steed.
Yeah, so it's very similar to what I mentioned, how that in our role there is already those requirements for those mandatory vaccinations, and definitely from my point of view, it seems like that because there's already that framework available, that it shouldn't be too difficult and it shouldn't be too surprising for people in our setting that this is going to lead this way, and it is going to lead this way. I reckon what Timu mentioned in terms of make it an educational point of view is really, really important, and particularly I think for the greater population that don't have the same level of medical education and health literacy that we do. It's really, really important to have that. And I feel like, and there's been a lot of commentary around this, and I'm not a social commentator by any stretch of the imagination, but there has been a lot of commentary around this, that making things mandatory is that leading to more people not wanting to do it because of this essentially a defiance of any authority. It's like if you told me about it, if you help me understand, yes, I'm more than happy to get it. But now that you're telling me to do this, well, no, I don't want to do it. I mean, I'm sure as a young kid and teenager, and even as a young adult myself as well, when you get told to do something, you don't really want to do it. But if someone's helping you understand why this needs to be done, there's probably people that are more likely to do it. So yeah, I'm in agreement with you, Timu, for the general population thing to focus on, and particularly for our patients as well. I mean, we come across patients as in our line of work, obviously, and it's really important that we advocate to them. But in terms of the Australian perspective, and specifically the perspective of where I work, I feel like our thinking has generally been a little more advanced with, not advanced in terms of we're better, but bit more progressive towards the this mandatory COVID vaccination.
Sorry, Alex. I think like the problem with the educational approach is that it takes a lot of time. Before we even roll out like basic education on vaccinations and mRNA techniques and everything like that, we hopefully have already gotten out of this pandemic, obviously preparing for a possibility of a next one. But yeah, I think in the interim, I would accept mandatory vaccinations, but then it would have to come with a stern promise of proper education on like the prevention of diseases, and then actually be implemented afterwards. If we just do mandatory vaccinations, leave it at that, wait for the next one, and then do it all over again, then it's not as good.
Yeah, I think that very wise words. And this approach that you mentioned, Harrison, if something is mandatory, I won't do it. It's so Polish. It is so Polish. There's even a rolling joke that if you want a Pole to do something, forbid it. Just say it. Yeah. And if you don't want Polish to do something, just say it's mandatory, and so on. Yeah, we are so like that. Guys, from the Medscape.uk, Paul mentioned on the beginning of our podcast, 56% of healthcare professionals in England raised safety concerns, 27% raised 27% would rather wait. Do you think that time will solve this problem, Mr. Silva?
I think it might. I'm pretty sure it will actually help with time, and when it becomes more normal, then I think more people will take it. The problem is that people somehow got the idea that this vaccination is experimental or new, while the actual techniques have been developed in the 70s, and there have been mRNA vaccines even after that, or like treatments based on the technique. So it's not really new. I think the anti-vax mentality got through better than the proper health education and convinced people that this is something experimental and you're being tested on.
But why?
And that's why they're scared.
Why do you think?
Yeah,
why they have such an impact? Why they're so effective? Those anti.
Oh, you mean the anti-vax mentality? I think I think it's a pushback reaction to like the society at large. So we are obviously, as Western societies, becoming more and more technocratic, and I think there's been a pushback. We've seen with flat Earth, anti-vax, New World Order, all this kind of stuff that's basically coming from the USA. I think that's a pushback to like this state-governed style of society, and I don't want to get in too deep into like that level of discussion, obviously, but I do think it's like one part of that. So people really want empirical knowledge. They only want to see how it works for themselves. They want to hear it from their families, their relatives, their friends, that, oh, I've got it, it's working, and somehow feel like that's a better proof than studies. And it's also going back to what Harrison said about medical literacy and all that stuff. But I think it's a funny point to make, to raise like an issue with the safety of it, because we use all kinds of preventative measures. We've used masks before, and one could argue, oh, those limit your airflow, and they have argued that, which is obviously not true. We use gloves on jobs, and some type of materials have been shown to cause allergic reactions to people, like latex, I think, or like the natural rubber. So yeah, we have all of these safety precautions that we use and don't even question anymore, even though they also have side effects or could have potential side effects to a group of people or like individuals. But somehow the vaccination is too much. And I find that a bit funny, to be honest.
Thank you. Harrison, is Earth very flat in Australia? And I mean, how strong the anti-vaccination idea or approach is over there?
Yeah, so it's a bit difficult to measure, I think, just given the prevalence of social media and the effect of social media. Timu mentioned before that people like that empirical evidence, that they like hearing from their friends and their family and people they trust. And you see it more and more now, particularly with social media during this pandemic, that people get stuck in this echo chamber. So people will, and it's human nature. People will socialize and relate to people that they relate to. People will find like-minded people, and it's a good thing, but it can also be a bad thing when there's misinformation spread. So when people are relying on their friends and their family for medical advice, and their friends or their family have these anti-vax beliefs and thoughts, then this echo chamber begins, and the only thing you hear are these thoughts, and you don't listen to everything outside. So in terms of measuring how prevalent it is, it's really, really difficult, because I find just anecdotally that that these voices that are saying this anti-vaccination, again, propaganda, we'll call it, they're quite loud voices. I think they are in the vast minority. I think the majority of people understand, not necessarily understand the science, but understand the requirement to listen to people that do understand the science. I mean, I know a lot of people in my personal life that say, look, I don't know how vaccines work, but I don't need to know how vaccines work, because that's not my job. Someone else gets paid lots of money to understand that and research that. I get paid to build houses, or I get paid to chop down trees, or I get paid to whatever it might be. And I think that's a really important notion to have. So yeah, in Australia, as I said, it's very difficult to say exactly how the proportion of people. All you can really link back to is the proportion of people who have been vaccinated. So again, it's about 75%. So roughly 1 in 4 people at the moment are yet to be vaccinated. But there's a lot of issues with: is it due to supply? Is it due to they just haven't got around to it yet? Or is it due to the fact that they are concerned, or is it because they actively don't want it and they are anti-vax? So all you can really say is it's less than 1 in 4 that fall in some makeup of that population, but it's really, really difficult to say.
Thank you, guys. I've been just challenged by one of our viewers. He says, you said that you promised that you will show us the proof of vaccination. Here you go, guys. This is my NHS app, and this is my COVID pass. So the proof of my vaccination. I will show it to this camera as well. So yeah, I am vaccinated. Are you, Mr. Silva?
Yeah, I am. And actually, it's a funny thing, because we were talking about like frontline staff getting the vaccinations first and all that stuff, and other people wanting to wait. I actually, I didn't really want to wait, but I did. Like last spring, I was studying for medical school, like entrance exam, and I was at home. I wasn't working. And I think they started rolling out the first dose around February in my company, or somewhere around there, which we were in the second line. So obviously, like very vulnerable people got theirs first, and also the ICU staff that were treating COVID patients. And then the next wave was A&E and ambulance. So yeah, I could have gotten that then, but I didn't, because I was basically staying home. I only went outside to walk the dog, sometimes to the store, but mostly my lovely wife did that for me. So I got my first dose about a month before I returned to work, and then obviously the second dose 12 weeks after, when I had been working for a bit. In hindsight, I should have been more active. If I would have preferred to have 2 doses before I went back to work, and I messed up a bit, but I did get them, and eventually they are now helping me to safely work, and I do feel really good about that. I haven't had any symptoms. I haven't had any clots that I know of. So yeah, it's all good.
Thank you. Harrison, what about you? Remind us, are you vaccinated and how did it happen?
Yes, yes. So I've had my 2 doses. So mine was a bit similar, I suppose, to Timu, in that I'd planned to be very active with it and get it as quick as possible. And I had an appointment booked, and at that time, as I had mentioned previously, the access to vaccines wasn't great where I live. Just given the supply issues, and so I had an appointment booked, and silly me booked it after a night shift, and I woke up that morning after about 3 hours sleep, and I thought, no, and I just rolled back over, and I got a call later on from the mass vaccination hub that was administering it. They said, "Oh, that's fine. You can walk in anytime whenever you're free," and it involved me going into the city at that time, and so that was for the AstraZeneca vaccine, and a couple of days later. In the news, they started this coverage around the clots and the thrombocytopenia, and the concern around that, and then the Therapeutic Goods Administration, who basically oversees all medications in Australia, changed their advice, so that I believe at that time it was only people over the age of 60. Because I know they revised it to 50, so I believe they changed it. Only people over the age of 60 were advised to get that particular vaccine because of the increased risk of side effects to younger people. And they were being very, very cautious about it. When you look at the statistics, I mean, talking back to the echo chambers of anti-vax, and people say, 50% of people get side effects. Well, yeah, I mean, side effects are prevalent in every medication. But the actual prevalence, I think there's been some 20 million, 15 million, I think it was, doses of that particular vaccine, and 6 people have died, unfortunately, which is horrible, but that's, given how many doses have been given out, that's an astronomically low proportion. And I'm sure, you two, and also any listeners at the moment working in the profession that have ever given any medication and then seen someone have a side effect. Some of them you can almost bet that they'll have that side effect. So those side effects in this case are pretty rare, but I think given the hesitancy in the public, they were very quick to sort of slow their recommendation. But anyway, so that happened, and then I thought, the only vaccine I have available to me is Pfizer, which was not made here, made over, I believe, in the US and sent over. But with the really, really low supply that we had in Australia, it was a number of weeks until I was able to get an appointment. But then I got my 2 doses, and had really, I mean, the second dose had a pretty sore arm and a bit of a headache and stayed in bed all day. But apart from that, fully vaccinated now, so I'm happy with that.
Yeah, actually, I didn't have any side effects apart from sore arm. Timo?
For the first one, I didn't have anything except for the sore arm. For the second one, I had like almost a day of fever and feeling really ill. Stayed in bed, but that passed really fast. So yeah, not bad, but some side effects.
I think the side effects are more common in older people and younger people, so that might be something to say about you, Alex.
Ouch.
I'm on mute now. Good, guys, thank you so much. Harrison, thank you. Timu, it has been a pleasure
Thank you.
having you on the show. Guys, please let us know in the comments to the video, what do you think? Is no job in healthcare a good idea or not really? And if everything will be fine, we will see you again in approximately 2 weeks. Ladies and gentlemen, Timu Silver, Harrison Steed and Alex Hepner, this was Group Call Live. Thank you for watching and having an amazing day.